Good morning, everybody. Thank you for joining us. My name is Sarah Wassinger, and I'm the President and CEO at the Chamber in Hays, Kansas. And we are here with you this morning to provide an update for reopening Ellis County, and want to introduce Jason Kennedy. He is the Director of Ellis County Health Services, and he has an update for us as we finish this morning. If you have questions that you would like to have answered, please feel free to type them in the chat room, and we will do our best to get as many questions answered as possible. Without further delay, I'd like to have Jason start with an update.
Good morning, Ellis County, and thanks for having me, Sarah. It's, as we all work through this process, I think it's important that we all have access to the information and that we have a willingness to collaborate and work together on this. For starters, the information that I talk about today it's all posted on our website, the health department website at ellisco.net. You can access it there. It's also on the governor's website and in several different places, and there's a link to the KDHE website. So at this time, the state has established a regulatory baseline for Kansas local governments. What that means for us is that under Executive Order 2029, we in Ellis County cannot be any less restrictive than what the governor's plan has. However, in meeting as a County Board of Health on Monday night, with my recommendation, the County Board of Health and I do not intend to impose any further restrictions that are any more limiting than what the governor's basic plan outlines. What that means for all businesses in Ellis County is that if you are not specifically prohibited under phase 1 of the plan, which includes bars and nightclubs, excluding already operating curbside and carryout services, casinos, indoor leisure spaces, including bowling alleys, fitness centers and gyms, personal service businesses where close contact cannot be avoided. If you are not listed in one of those organizations as a business, then you are allowed to open under phase 1. If you are one of those listed businesses, you are not allowed to open in phase 1. Almost all of actually every one of those is allowed to open, however, in phase 2, which starts May 18th. There is some minor additional restrictions for bars and nightclubs, which would be at 50% capacity, but that does not start until May 18th. So under phase 1, any other business that's not specifically mentioned is allowed to be open. Those businesses, we encourage you to follow your industry standards. We'll also post a link to the industry standards that are referenced in the governor's plan. We'll post a link to those on our website, or you can find those on the governor's website as well. Those industry standards are the same things that you guys have already been operating under. We're lucky and fortunate here in Ellis County. The business owners have done a phenomenal job throughout this process and even prior to this of keeping customers safe, providing friendly, courteous service, and really keeping the food and all customers and employees safe. I know you guys will continue that process as we go through here, and you guys are the best people to run your businesses. If you have specific questions about plans or about the governor's plan, feel free to reach out to my office. Really, the best way to do that is COVID-19 questions at ellisco.net. And the only reason I encourage people to email us is that we can actually then send or push out the information to you via links or attachments so that you actually have those documents in your hand to look at. There is some good industry-specific guidance out there, which I'm sure you guys all know about. Like I said, we'll post a link on our website to that, as well as the governor's plan. As we look, a quick update really on Ellis County and where we're at. We do still have 8 confirmed cases. If anyone noticed on the KDHE map yesterday, they did add an additional case to take us to a total number of 9. What they're doing now is those are probable cases. So probable cases fall into one of 2 categories. They either didn't have or had incomplete testing that did not, confirmatory testing through a lab as far as the PCR test that we've talked about in the past, and they were a close contact of someone that was positive, and they had symptoms at some point, they would be considered a probable case. Or if they had serology testing type testing, so an antibody type testing, and they were a close contact and they had symptoms, the state is going back retroactively. So meaning in the past, they're going back and looking at the data that we've uploaded into EpiTrax, and they're determining whether they believe that person would be a probable case or not. What that means for Ellis County is you are at no risk from these cases. These cases are old cases, could be up to 2 months in the past. There is no, these people would have been dealt with at that time as far as their quarantine, their isolation, but we in Ellis County have no new cases as of right now. Our last confirmed case would have been on 4/17, would have been the last case that we actually had. So we're about 3 weeks into this with no cases. We've had 0 hospitalizations to date of Ellis County residents, and we've also thankfully had 0 deaths. We as of today, we've completed 12.5 per 100 or per 1,000 is our testing rate. The Kansas average is about 13.25, so we are just slightly below the Kansas average. But a lot of the Kansas average for testing has been driven by the high volume areas as far as Ford County, Finney County, Seward County, where they are testing almost everybody in the population. So we are up there with our testing. We have testing capacity, we have testing materials. So we do have the ability to continue to move through these stages. We also, as of last week, trained 17 contact tracers, really with a partnership with internal training, with a partnership with EMS. We've trained 17 contact tracers, which puts us double what the state would like to see us have. We've requested 2,800 test kits from the state. We did receive a shipment of 500 tests that was part of a prior order. So the 2,800 test kits, we actually are still following up and trying to get those here into Ellis County. I know the state has ordered 500,000 tests, so it looks good that we will at least continue to have testing capacity. And the reason I give that to you guys as business owners, and some of you are saying, man, I'm not sure I care. The reason that I think that information is important is because we have measures in place and we have taken the steps as a county to protect the residents and to protect patrons of your businesses. Just as we're asking you guys to take steps to protect them, we from a public health standpoint have taken steps to protect them as well. So it is okay to go back out into society. We do have the testing capacity. We do have low case numbers. We have seen a continued downward trend. We're meeting all of the state's health metrics. So if you're asking yourself as a business owner, is it safe? Is it safe to do this? That's something that you would need to use your industry standards, but you also need to take a personal risk assessment. Look around your business, see if there's areas of improvement for not just for COVID-19, but is there areas of improvement for safety as far as just general good practices. So I know you guys are doing your part to make sure that is happening, and I appreciate that. The patrons appreciate that. Really, all of Ellis County appreciates that. I know you guys are going to continue that process. You'll continue to do your part to protect the citizens and visitors of Ellis County. Now we talk about visitors coming in. The KDHE mandated travel restriction is still in place. So I'm not going to read off all of those states, but basically the KDHE mandated travel restriction, go to KDHE's website, you can pull that up. There is still a travel restriction. So we should still be encouraging people not to travel from outside of our state. We should be encouraging our employees to not travel from out of state. If we do go to those states, you are still mandated to have a 14-day quarantine. So make sure that we're educating people on that, and make sure that if your business has a huge draw from out of state, make sure that people understand that they are under a KDHE mandated quarantine when they get here. I don't know what that travel restriction will look like, if they'll keep it in its entirety or not when we go to phase 2. We have not received any guidance or any FAQ documents on what that'll look like. It does still mention in phase 2 that there will be some travel quarantine or guidelines. So I think it would stay in place as far as phase 2, but I'm not 100% sure. So that's something that we'll try to keep you posted on if something changes there. As far as activities, if anybody on here has any, is part of the organization, community centers are still closed. Large entertainment venues with capacity greater than 2,000. Fairs, festivals, parades, and graduations are still closed. Public swimming pools stay closed. Organized sports facilities and summer camps. We have had some questions in the office about organized sports. So as far as phase 1, so lasting until May 18th, organized sports is a prohibited event under the governor's plan. In phase 2, the organized sports prohibition goes away. So we can start moving towards some organized sports again in phase 2, which, like I said, begins May 18th. We've talked about the businesses that under Executive Order 2029 need to stay closed, and that's the bars, nightclubs, theaters, like I said, including bowling alleys, arcades, museums, fitness centers and gyms, nail salons, barbershops, hair salons, tanning salons, tattoo parlors, and other personal service businesses where close contact can't be avoided. Now, I understand that is a hardship for certain businesses. I understand that certain businesses see this as an unfair measure. I would encourage all business owners to comply with this order for another week. We in Ellis County cannot issue any orders or cannot help you in a way to be less restrictive. Now, I know this order does not pay your property tax. This order doesn't pay your staff. This truly is a hardship that I don't understand because I don't own your business. But I want you to know that I am empathetic to that, and from a local level, from a local governmental standpoint, everyone's empathetic to that situation. We really are. Like I said, I know empathy doesn't pay your bills and it doesn't pay your employees, but we do encourage you to comply with this order. Don't make this a local standoff. Comply with the order till May 18th. If you want, or if you feel this is an unfair situation, I absolutely encourage you to reach out to your senators, to reach out to your congressmen, to reach out to anyone at the state or federal level and voice your concern to them. Allow that voice to change our future plan. We can't impact the plan now. We are legally bound to follow this plan, and I encourage all business owners to continue to comply with the order if you are specifically listed. Now, May 18th, every business is allowed to open under the governor's plan. As long as we continue, everything looks like we will. The only restriction at that point would be bars and nightclubs would operate at 50% of their total occupancy. So bear with us for this week. We'll have more information for you guys next week, hopefully, as far as what phase 2 looks like. But for phase 1, it's very clear in the governor's orders, the businesses that remain closed. We'll go through the FAQ document to see if we can answer a few questions before we receive them. But I want to hit this now, and we'll hit it at the end. Best practices still apply here. Just because we're allowing, just because businesses are open and we're starting to go back out, best practices still apply. Those best practices are to stay home as much as possible, especially if you're in the at-risk population or you are fearful. Stay home. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water is not available, use hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, and mouth. Those are the portals for transmission of virus. That's how you get it into your body. You don't get it through your skin. You get it through your eyes, nose, or mouth, predominantly nose and mouth. Distance yourself from others when you're in public, especially if you're a senior or have a medical condition that puts you at high risk. So the social distancing piece, we sort of confused it with complete closures, but the social distancing piece stays in place. Really try to avoid that contact. If you can look at ways within your workforce to increase those social distancing pieces, if you can look at ways within your business to increase that social distancing, those are still best practices, even as we open up. Cover your mouth and nose with a cloth mask when in public. So this is a KDHE and a CDC recommendation. It's not a requirement. Masks protect other people from you if you are sick. Masks cut down on the droplet spread. So if you cough, sneeze, something like that, hopefully that stays on the backside of the mask. Masks are not great at the mask that you wear protects the other person, and the mask the other person wears protects you. So make sure that you understand how those masks work, though. If you're constantly touching your mask, messing with your face, you're opening up a vehicle for transmission. If you wear a cloth mask and you don't clean it appropriately, you don't launder it, you're also opening up an opportunity for a bacterial infection or something like that to build on the backside of that mask. So make sure if you wear a mask, you're going to educate yourself. You're going to understand what that mask is for, the intent of that mask, and how it works, and how to use it to effectively protect you and other people. Like with all this, making sure that we're educating ourselves. The most important thing we can do right now is to educate, stay up with what's going on, and continue to move us forward in these phases. Clean and disinfect frequently touched surfaces daily, including phones, keyboards, doorknobs, handles, and light switches. So within your business, you're the best person to determine what those frequently used surfaces are. I don't know how each individual business runs. You guys do. So look at that stuff as you come in every day. If you see something that you missed day one, maybe that's another frequently touched surface that needs to be disinfected. So making sure that we're constantly reassessing this as we move forward is going to be really important. And protect and shelter the most at-risk and vulnerable. So if you're in that population of 65 and over, if you have significant pre-existing health conditions, making sure that you're doing a personal risk assessment and determining how this affects you, what you can do to protect yourself, and making sure that you are doing that on a daily basis. All of those basic practices will remain in place through all of the phases as we transition towards recovery. We'll hit a few of those again at the end, but we'll hit some specifics as far as the governor's plan. We finally received an FAQ document this week, which would have liked to see this out prior to opening. Hopefully we can get one for phase 2 next week, and as soon as I get that FAQ document, I'll make sure that we get it out. We might try to schedule one of these webinars if we can get it in there in time. So we'll try to get you as much information as possible, because that is truly the key to us moving forward. Last week we talked about restaurants, and I actually gave you guys incorrect information at that time. Restaurants can have more than 10 people in them, or the restaurants can have more than 10 people at one time. We knew that. However, they can also have more than 10 people at a single table, and those 10 people do not have to be cohabitating members of the same family. So what that means is you can have 5 couples of 2 that come to a restaurant together, can sit at a table together, as long as the next table is more than 6 feet away. Now, the tables don't have COVID, people might. So making sure that you distance the people, not so much the tables, is really the key piece there. But you can have 10 individual people at one table as long as they all know each other and as long as they come together. So the point of that is the contact tracing piece. We can't seat just 10 random people at a single table together, because that's hard to contact trace. This is the state's justification, not mine, by the way. I'm reading off their FAQ document. So if 10 people come to a restaurant together, if someone does happen to test positive, we can contact trace that through all 10 people and hopefully isolate, quarantine, and keep that from spreading. So that's the state's guidance for the 10 people at a table and not have to be cohabitating. Now, if we transition that to churches, which is also specifically mentioned in this, so restaurants can have 5 couples of 2 that all sit at the same table. Churches, on the other hand, they allow more than 10 people to be in the church at a time, but the group sizes, individual group sizes, need to be less than 10, and they have to be cohabitating members of the same family. And then the next group would need to be 6 feet away from them. And making sure that in your business, church, whatever, make sure you're looking at the fact that viruses don't just spread side to side or just front to back. They spread in circles. So it's really a 6-foot circle around those individuals. So if we're spacing pews, spacing things like that, making sure that it's 6 foot in all directions. I will give a shout out to Father Jared. I'm not sure if he wants this or not, but he did post actually a pretty funny video, but his information was correct on St. Nick's church website of how that social distancing looks, at least in that individual church. So if there's any churches on here, encourage you guys to look at it. Work as a faith community to determine how this plan works within your organization. Same thing as restaurants. Work as a group. If someone's doing something over here and you like it, make sure we implement that, or make sure that you guys are working together. I think that's collaboration is always a good plan. What's the difference between bars and restaurants? So the state's definition for this is that in a bar as opposed to a restaurant. So in a bar, people go to intermix, commingle, dance, whatever. That's, from their standpoint, going to be a contact tracing problem. Where in restaurants, if you go there with a certain group, you sit at that table, you don't have a tendency to intermix between tables, and so you can contact trace that. And if anybody doesn't know what contact tracing is, basically that is the process where if someone tests positive, the health department, you receive a phone call from the health department. The health department will call and do an interview with you, and we'll say, okay, who all have you had contact with in this time frame? Whatever that time frame is, as determined by KDHE standards, we'll trace those steps back, and we'll say, okay, so you had contact with this person. Well, contact is defined as being within 6 feet for greater than 10 minutes. So anyone that you had that close contact with, then we would call them. And we would say, okay, you're now in quarantine for 14 days following KDHE standards because you were determined to be a close contact of this person who tested positive. And then from there it stops at that contact. But the original person, so that's that contact tracing. We basically go back, trace your steps from the time that we believe you to be contagious, and we trace your steps forward to where you're in quarantine, where you would no longer have any contacts. So if you see reference to contact tracing, that's what that means. So for bars and restaurants, they think that it's in a restaurant, it would be easier to contact trace if someone happened to be positive as opposed to a bar or nightclub. Like I said, once we go to phase 2, May 18th, bars and nightclubs can open at 50% capacity. Self-service options and buffets. So the self-serve drink machines, self-serve buffets, things like that, they can open. They are not specifically prohibited in the governor's plan, so they are allowed to open. Now, use your industry standards on how to clean and disinfect, how to make sure that we are reducing our chance for viral transmission. You guys have been doing this for years anyways. You guys already understand these principles, so making sure that you're continuing to apply those principles if you decide to open up your self-serve or buffet options like that. Like I said, they're not specifically prohibited in the governor's plan, and Ellis County has not chosen to impose any further restrictions. Libraries can open in phase 1. Organized sports teams, we talked about that. They are not allowed to be open in phase 1. However, they are allowed to begin practicing in phase 2, and that's the same phase where sporting facilities are allowed. So this does not, the state's guidelines says this does not prevent individuals from engaging in outdoor activities as long as they can maintain social distancing, tennis, playing catch, etc. The goal of the provision is to limit the spread of disease by preventing large teams from congregating together to play sports in which physical distancing is not possible. So this is the phase 1 guideline. Phase 2, hopefully we have a little bit better guidance, but organized sports are not allowed in phase 1. Parks and playgrounds, I think you guys have seen that the city of Hayes opened all parks and recreation facilities back up. That is allowed under the state's plan because the state's plan does not specifically disallow it. So at a local level, we have not imposed anything further, therefore that's open. Dirt track racing, no, these are not open these are open in phase 2. So dirt track racing is allowed to be open in phase 2 as of right now, which would be May 18th. Churches can have more than 10 people in a service at a time, like I said, as long as they're maintaining those less than 10 groups and their family members and their 6-foot distance from other areas. Bowling alleys are not open in phase 1. We've talked about that. Pet grooming is open in phase 1. So yes, pet grooming is open. Wedding receptions permitted in phase 1. There's a bunch of factors that go into that. If you do have a specific question, please send that to COVID-19. Those are kind of individualized decisions even by the state's guidance. Golf courses remain open and have been open. Public auctions are open in phase 1. Rodeos are not open in phase 1. Funerals are permitted in phase 1. And summer camps that are operated under a licensed child care facility are open in phase 1. However, general summer camps not operated under a licensed child care facility are not allowed in phase 1 because of the mass gathering restriction. I don't honestly have a good answer for you on why they made that distinction or not. So mass gatherings, still no more than 10 individuals allowed. So concerts, big mass gatherings, things like that. As we go to phase 2, that mass gathering piece goes to 30. And then as we go past that to phase 3, which starts June 1, the mass gathering goes to 90. We are at about 10:24. So Sarah, if you have some questions for me, we'll open it up to a few questions.
Thank you, Jason. We do have several questions. We know travel is encouraged at this time, but is there any concern that travelers over 70 might bring the virus here?
So Obviously, there's concerns of viral transmission from really any sources. The key piece with viral transmission is person-to-person contact. So if we can eliminate that, if we can stay outside of that 6 feet area, then there's really not a great avenue for that virus to transmit. So we can mitigate that even along I-70. We can mitigate that in our own businesses. We should be mitigating that just in our normal day-to-day life as we're out moving around. So there's no increased or elevated risk as long as we're able to maintain that social distancing piece.
The next question is, should everyone be wearing a mask when they go out into public now? Should employees be wearing masks at businesses that are open?
So the mask piece, KDHE and CDC, like I said, like we talked, they have came out with recommendations that if you cannot maintain that 6 foot distancing, their recommendation is that you should wear a cloth mask. Now, as far as in businesses, that would be up to you utilizing your industry standards and making a decision on what works for your business and what works to protect your employees. Each industry has some different standards or different things that they allow. So using those industry standards, like I said, we'll post a link on our website to what the governor has labeled as industry standards. And there's also, you guys have your internal sources for industry standards. So right now, KDHE and CDC recommend the use of a cloth mask if you cannot maintain that 6 foot distancing. So if you're out jogging in the park by yourself, I find it unlikely that you would be within 6 feet of someone. So deciding for yourself, taking your own personal risk assessment to determine whether a mask is important or impactful for you.
At what point are hotels allowed to be open, or at what point are hotels allowed to open their breakfast rooms and their swimming pools?
So I'm actually not going to answer that one, and I'll tell you why. I don't have the specific information as far as hotels. I know pools are still closed in phase 1, and then you've got that mass gathering piece in there. And as far as the breakfast rooms and things like that, as far as I'm concerned, that's no different than a restaurant. So unless your industry specifically prohibits it right now, you would have to follow the same standards as a restaurant, in that you can't have more than 10 people at a table. You need to have tables 6 feet apart. Your buffet lines, things like that, they're not specifically prohibited in the governor's orders, and we have not imposed any additional restrictions. So by default, they are allowed to be open. You would just want to use industry standards to make sure that you are disinfecting those common use surfaces, that you're making sure that all the normal steps that you go through to keep food safe. Now we have to take those additional measures just to make sure that we don't open a vehicle for viral transmission.
Will these weekly webinars be continuing as we go forth through the reopening plan?
If they're beneficial to people, I'm more than happy to keep doing them. I'm looking at trying to move it up to get it away from Fridays if the state will give me the guidance documents. So if I can get the guidance documents out early next week, we might try to move this up to like Wednesday or Thursday so that we can give businesses as much lead time to deal with the new standards as they come. We just did it on Friday this last time because they didn't have the standards out till Thursday. So if they're beneficial for people, I'd be more than happy to continue doing them.
At this point, we don't have any more questions, but if people want to type in any final questions, we'll try to get those answered before we conclude today's call.
And I'll tell you what, I encourage everybody to continue doing those basic standards that we've talked about. The best thing we can do to protect ourselves right now is to really wash our hands. That's been the key from the start of all this, is washing your hands and good social distancing does impact viral transmission. That is a documented fact. And so as we continue this, and this goes for flu season, this goes for cold season, this goes for COVID or whatever, washing your hands, good hand hygiene, not touching your eyes, nose, or mouth, and maintaining that social distancing piece really is important as we move forward and as we continue. Like I've told people several times, learning how to live and interact in life with COVID is going to be a very important thing for this next year, because COVID it didn't go away with the governor's phase 1. It doesn't go away with the governor's phase 2. We will have or could have instances of COVID as we continue through this process. How we deal with that, how we keep ourselves safe, how we protect those around us, and how we continue to run our businesses and grow our businesses and continue to have a flourishing economy in Ellis County will be up to all of you as business owners to help move us through that process.
And do you know of an approximate date, Jason, of when Governor Kelly will be making the decision as to when we move to phase 2 on May 18th?
I have absolutely no idea. I've not seen anything as when I would assume she's going to wait until late in the week, but that's 100% an assumption. Yeah.
Well, we don't have any other questions at this time. I would like to take a moment to thank Nex-Tech for setting up the webinar for today and just making sure that everything went off smoothly. Jason, do you have any other, announcements or things that you'd like people to hear before we conclude?
Sure. I honestly just applaud Ellis County for the way that we've handled this process, the way that we've walked through this. I applaud everyone that has followed the recommendations and followed the guidelines. We will get through this together. We need to continue these basic public health measures, continue to listen to the information that's out there, and let's all move forward together.
Well, thank you so much for taking time out of your very busy schedule, and to everybody who participated in today's webinar, thank you. We will be sending out information if we have another webinar next week, and at this point, we just wish you all safety, health, and happiness. Have a great day.
Thanks for having me.